So hi, Jasmine. I'm delighted to be having this conversation with you. Let me introduce you. So you're Jasmine Badge, and you're a trauma and crisis specialist and founder of Heart to Heart Psychotherapy. You've got over 12 years experience in child development, and you're an active advocate for mental health. And I've got to know you by your frequent illustrated LinkedIn posts that are full of insights and tips about mental health. And I think it's a wonderful resource that you publish for your community. So thank you for being here. So I just want to start off by talking about a few stats that I came across when I was researching anxiety in children, and that I found quite alarming. So even before the pandemic, the stat was that 1 in 5 children have a mental health or learning disorder. And in Singapore specifically, the suicide rate among 10 to 19-year-olds has been rising year on year. So as a professional who's been working in this space for over 10 years, what is your personal experience? Have you noticed a change in the conditions that you're having children referred to you for, or have you noticed more people coming? What is your experience?
Okay, so before the pandemic, right? So because I'm in my private practice, and I will, I will get to WhatsApp or email inquiry for people seeking help or asking for appointment. So before the pandemic, which is like 2 years ago, my daily inquiry of like wanting to see me, wanting to set the appointment is about like 6 to 8 new inquiry. But of course, we can, we are like dentists, right? I only have 8 hours. So during the pandemic, and then as it grow, right? Like right now, my daily, I even have this, like the fear of looking at my phone is about 19 to 25 of people seeking help. And ever since there is another incident where the students hurting another or killing another child, right? So, and then onwards, right, that we have even more parents sending kids to want to make sure that they are fine.
Yeah.
So seeing a lot of teenager compared to the past 2 years, and as young as like 7, 6 years old.
So, Jasmine, is that because the parents are becoming more aware as to potential mental health conditions, or is that because there are actually more children with conditions? Do you have a view on that?
It can be both. They coexist, right? So because mental health, like I said, mental health is with everyone. Right, so we all have mental health, we have physical health, but it's just that when cancer, like being known, right, then we start to like go for check, do a blood test. You see, it's always there. It's just that like there's no education, there's no awareness, right? So we were just thinking like this is something that because of certain trigger then it causes thing, but it's always there. It's just that it's like it's not undiagnosed or untreated. And also because of the pandemic, right? People are getting angry with the lockdown, the uncertainty. So the acting out is a little bit more obvious. And also because of the technology, right? In the past, our world is just restricted to the newspaper that right? Or the news that you watch. Right now, it's like the whole world is on your screen, and the world becomes so close and so open and so transparent. Like we see all the weird news, right? All the scary news. It's just like actually they are not new. It happens, but it's just not like approach or reachable as what we used to be. So this is we think, oh, the world is getting so sick and so weird, but no, right? And younger children, like your 8 years old and our 8 years old, or our time, we don't look at those things. But right now, they see everything. They learn about depression, divorce, suicide, bombings, gun shooting. They know. And it's like young age where the mind is not even ready for that. So that can also cause a lot of fear, because it's like not able to understand. Right. So we can call it a secondary trauma, because your brain got shocked for something that your brain is not prepared.
Right. Okay. So Jasmine, can you explain to us what is the difference between fear, stress, and anxiety?
So we are looking at the fear, anxiety, and stress, right? So fear is something that usually is unknown, right? This is a young children, they talk about, I'm scared of ghosts, so I don't know what is ghosts. Like we fear a monster. So you fear of someone because you don't know what they can do to you, right? Like you fear of your future because you don't know what will happen. So that will give us a fear. That doesn't mean this is wrong emotions, right? So it's just a where it comes from. It comes from somewhere which is not familiar, but when we walk towards it, or it somehow closer, or we will have it, so that we have this fear, right? So stress is something that that we actually find it overwhelmed, right? It's too much, you see. So stress is a very big topic that where, like I say, when I during my stress workshop, right? So a lot of people like, where do you learn about stress? Anyone teach you? No. We just learn about stress from like what people tell us, like, oh, she's stressed because of exam. Oh, he's stressed because of the girlfriend breaking up. Oh, she's stressed because she's looking for a job. I was like, what is that? It's just something feel like, oh, difficult. Something like, there's like no one can tell you what is it about. And then we try our whole life trying to manage stress, like you manage something that you don't even know. You see, so stress is a very big topic, but stress actually comes from I call it so stress it comes from where you have this concern, right? So once you have the concern, so usually with concern you just find a solution, right? So when you try to put too much onto it, you turn the concern into worry, so it's heavier, right? So when you worry, you don't find a solution. When you worry, you start to have a little bit of like fear and helplessness in there. So when you do not do anything about it, right, it will escalate into rumination. So go round and round and round, it spiral down. So that's where you try to feel the anxiety, the anxiousness. So when you start to feel the anxiousness, what do? We run. So the way you run is called the way you meet the stress. You see, a lot of people just couldn't take it. Some people would just, go through it, and then until it affect their, their life, like their health or their relationship or their productivity. You see, so usually we thought that stress is just something that I just feel a little bit difficult. But if you don't deal with that, right, you don't find a solution, or you don't work on it, or you don't come face to face to it, right, it will only accumulate. So this is where we call the word burnout, right? And then with the younger one, they go all the way spiral down to depressed, where they gave up because they don't know what to do. So they're all linked. So we cannot actually put them like, oh, it's individual. Because if you see that they actually have a stairs, so they start to form a club, and then they join they recruit the member, until it's so huge that you don't know what to do. So this is where I think we have to have that the knowledge, right, about like what is mental health. You see, when people say mental health is equal to physical health, and then what else? So there is mental health. They also have mental illness, and then we have severe or serious mental illness, and then we have untreated severe or serious mental illness. Right? It's the same thing when you have physical health. I mean, you are healthy. You feel like, oh, I'm good. I know I can do stuff, and I am happy, and I don't feel like my nose blocking, I don't have cough, so you are healthy. So when you are physically ill, so you have a watery eye, throat, like sore, and then you start to like have a runny nose and you couldn't sleep. So these are physical sickness. So this is called a mental illness when your mental well-being is declining. But if you do not seek treatment, where you have sore throat, like you have sore throat for 3 months, it might turn into throat cancer, right? But people do not know that the way you treat your physical health is how you treat your mental health. You know that, oh, declining. You start to like a lack of focus, you couldn't sleep, you get agitated. So this is like when you are having cough, your nose is runny, your ears block, you feel giddy. Where do you go? You seek help, right? You don't
Right.
wait till you are seriously ill and then you got so worried that like there are people like they're so ill that they're so afraid to get the bad news, they go untreated, and we know that. It's the same way. So this is where like people need to know that there is a way to actually take care of this.
Right.
But because we just think that mental health straight away is mental illness. No, So it's untreated mental illness that make the world worry. You see, but
So
why do you want to go there?
So, Jasmine, talking about specifically about children, sometimes
Hmm.
it's might not be obvious that they have
Of course.
a mental health condition. They may be very good at hiding it. What are the signs that me as a teacher or as a parent I can look out for to the point where I realize, wow, this child does need some help?
Right. So you see, children, we don't talk about like the clinical one, like they have ADHD or they have schizophrenia, right? So we talk about like anxiety, anxiousness. First, let me make it very simple. How do you tell difference between nervousness and anxiousness, right? If you are nervous or a child is nervous, like anyone, not just a child, anyone, when nervous, right, you will still do it. It's just harder. You find it just harder. Like you have to go on the stage. You wouldn't say that, oh, I can't do it. Like you still do it, like exam, right? You're nervous, but you still walk into the exam hall. You nervous. So nervousness, you see, there is a word called hard or harder. So there's nothing else. Right? It's just difficult, so difficult. Like you're waiting for your medical report, right? You're just nervous. You're not anxious because you're still waiting. You not say that, I'm not going to look at the report. You don't do that, right? So you see a child still doing it. So there is nervousness. Anxiousness, there's one big thing you see is helplessness, right? When you see a child is helpless. But helpless is like, again, very hard to visualize. So what is inside helplessness is first, inside helplessness is three things. One is that nothing I can do or I don't know what to do. So they use the word, I don't know, I can't. Okay. The second is like, no one understand or believe. Okay. Which is like, oh, no one understand, no one believe, no one cares. So they won't tell you. Right. And the third one is like, no one can help. You see, so they don't even asking for help. They just use the word I can't, And then when a child say that, I can't do this, and then when you say why not, right? They say no, you don't understand. You see that? You talk, you listen, right? You see how they compose their story. You know that is not nervous. That's called anxious, right? You talk to children, you say that the child said, no, I can't swim, Then you say, why don't I give you a float? You say, no, you don't understand. So that is helpless. That's helpless. So what makes a child come to this state? And the very big trait that I see in all my parents who actually have anxiety disorder is lack of trust. Huge. Everyone, if you have this anxious feeling or you have this anxiety disorder, you will see them. They have a lots of doubts. They don't trust others. They don't trust themselves. So that is where, like no one can offer any help and you cannot do anything. That's where you lump up, it becomes so helpless. So to spot a child, right, and you see how the interactions go, right? You can ask them, why are you not doing it? Right? Some they say, I try and I can't. Then you say, why not I sit with you? You say, no, you don't understand. So this is where it's very easy, just 2 lines. You can catch when the child say that, they say you don't understand. No one believe. Teacher don't care. My friend don't care. Or these are the components of helplessness where you can see there is an anxiety in there. So that is where the way of talking to them have to be like really carefully managed. Otherwise, they will carry on because the more when the child is in this anxious mood, they're already helpless. They're already not believing that you can help. You will believe, you will understand, and then you try to do all kind of solutions, talk, right? You will actually push them even further. They say, see, you don't understand. See, all your method is not going to work, and you don't know. And they will just shut down. That will go into a disorder. So they're unable to function. And then we keep thinking that we trying to help them or fix them, then they will spiral down to depressive mood. They literally will just try to hide because like they don't know, they get angry, right? When I believe you don't understand, even though you are my mom, and you keep trying to tell me whatever you understand, I get upset with you. So then
how
you
do
can see.
how do you show them that you do understand?
First of all, we can also say that, yeah, I don't understand. But many times we thought that we are adults, we should understand, like I understand it is hard. Then she would think that, how would you understand it's hard? Right? So the most important is like, first, look at the one thing that like no one understand, no one believe, right? To reconnect back with the child, we have to convince them that I believe, right? Only when I think you believe, then I can tell you more, isn't it? So there is a lot of part that the adults are actually miss, right? We put so much on the problems, like on focus on the solution, just trying to help a child, but the child say, you don't know. You say, I know. And then some parents say, I even share my, my past, my childhood, my failure. And then you say, see, I'm now okay. So that is a worst, worst conversation you can have with a child, because when you tell your child that, yeah, I used to be so bad at this subject and then I did it. Now see, to her, like she say, yeah, you're always very good. I'm not like you. Then they will actually form a gap of the expectation that I cannot never be like you. So the more I should disappear, because you're always so good. You got bullied and then you stand up, you fail your test and then you pass again, and then you do this, and then you always can make it. But what makes you think that I can be like you? So I will be more fearful that I can't be like you, and I don't want to further disappoint you. You see? So this is where we have to make the child believe that, or convince them that I believe your story. I believe it is hard for you, right? And I do not want to bring another student, say, they see, look at her, she was this and now she like that. No comparison. So reconnect back with them first, so then you can further, like show up to show them that like I want to help, not I can help. I might not be able to help, but I want to. Okay, I believe you and I want to, because a lot of parents say that, fine, I understand. So, and I can help you. It's a different story. Okay, I can help you and I want to help you. It's a very different story. We don't use I can help you. Then you again show me you are superhuman. You have all the solution. I just couldn't do it. I even fear of the solution because I can't. Well, if you give me your super solution and I couldn't do it, then it caused me more anxiety. So these are the words that we use that help someone who actually ruminating. right? You catch their words and you go to understand that what are you giving them. You see, so and anxiety is just like, you see, there are four uh, component that cause us, anxious, right? The first one is just like fear of making mistake, right? And then the second one is like fear of getting someone angry, like, don't want to upset someone or disappoint people. And the third one is like, I think the big one on children is losing love, right? So the fourth one is about physical pain and death. So I think there is so much on children. The first three, when children their whole life, like I say, kids come to our life, right? We only one mission, to love us, right? So they only what they know is about love. They say, I want you to love me. I want my friend to love me. I want, because I love you. I love you. You love me back. So this whole thing go on in their life, right? Their little world. So, and they learn along the growing up, they're knowing that when I make mistake, adults get upset. When the way they get upset, right? And then they make me feel they make me feel like I'm harder to love or they don't love me. You see that? So there is where when the parents are using their bringing up, like of like you want to prevent mistake, you try to, you give too much of the pressure on, like you want them to achieve, right? You're trying to help them to have less trouble. All this is like you actually tell the kids that if I am trouble, if I'm flawed, I will lose this love. So then they're constantly thinking, am I loved today? Am I worth your love today? So that is anxiety. There's anxiety. So that is where a lot of parents, they say that, oh, my kids is very sweet. Every day, almost daily, the child asks the mom or dad, do you love me? Do you love me? Are you happy? This is a bad sign. Right? So this is not sweet. This your child is guessing. They're scared. They're not sure. If a child is, it's just like any a relationship or a romantic relationship in adults, right? When you have to constantly keep asking your spouse or your partner, do you love me? Do you love me today? Do you love me today? What is there inside there? Insecurity, right? You fear that the person, like, do you miss me today? Do you think of me today? You're like, why do you have to do that? Because you don't trust, you don't believe that, the person actually like love you for you, or you don't believe that you actually worth being loved, even though you didn't perform today. You see? So when a child show this, ask you questions like this, we have to have the reflection, like where they come from. It's not because they are sweet. You see, they can say, I love you, mommy, right? But if they, sometimes they ask, do you love me? It's fine. But if they, the frequency is a little bit intense, so parents have to take note, right? Like they say, are you happy? Are you not happy? Like they're checking on your emotions. They're not showing concern because they're not there yet. They are actually trying to save their ass. Like, am I in trouble? Am I in trouble? Am I in trouble? So if they're constantly doing this, right? Anxiety is like their best friend, right? So it's very easy to catch for at home. So in school, the teachers just have to have a conversation and they will have to, look at the words that the child use. Yeah.
So that's interesting. So is it actually primarily in the words rather than in the behavior?
Of course, behavior is very easy to see, like children. So if they have like they peeling their nails or their skin,
Yeah.
right? Or they chew their pencil,
Yeah.
right? Or they I don't know whether they're still using pencil or not because they're using computer, right? They fidget a lot. They fidget a lot, and then the behavior change, right? Behavior change. They actually like at home. So they actually when the children when they're asleep, some children they kick. in their sleep, they kind of like angry, but they're asleep. So all this is a physical, manifestation of like the anxiety they don't know how to express, or the kids get like easily tears, like we call it like so sensitive, right?
Okay.
Yeah. So these are the physical sign that you can see the child is having and it's like they when they talk, their fingers, or they tap their feet, right? They're touching something, or they cannot hold eye contact. So all this is could be, it's not just nervousness. So those can be anxiety is acting out. Yeah. Or they get angry. Yeah, anger in children is another way, not just stress, but it can be anxious because it's like a hard rock on the chest. They have to just release it. Yeah.
And what do you think are some of the factors that are leading to this anxiety in children in Singapore specifically?
Okay, you see, when this is a country, our children that don't raise by parents, right? The children go to school at a very young age, and then they're raised by domestic helper. So, and the connection, right, is not it's not enough, right? Because feeling safe and connected is the basic needs of humans, right? So if you send your kids at 18 months to nursery or baby care, imagine at 18 months they have to start to, like, they literally like out into the world to mingle, to social, right? To learn about other adults and other kids that they don't understand what's going on. So that where the helplessness start to come in, right? And then they have to learn to cope because they literally learn that no one can help them. So they learn to distrust, right? And they do not understand that the separation anxiety at the 18 months. So 6, 7 years old, yes, we can make them understand that eventually know that mommy will come and pick me up and things like that. But 18 months, you say goodbye, I cry, and then you never come back. And I don't know the timeline. I don't know how long you're out. Yes, you come back, but tomorrow it happened again. You see, so it's a constant, right? And then when everybody when school ends, right, I don't see you. I see helper or school bus, right? So you don't come and receive me outside the house, but the helper. So the helper will bathe me, the helper will feed me, you know. So I have this a case of these parents. They came to me. They say that they just have a baby boy. So the daughter is 4 years old. So after when the baby boy is about, I think 5, 6 months old, and they both are working parents, and they have a very good reliable helper that been like been with them. But what troubled them, like what the reason they come and see me is like the daughter, the 4 years old girl, she start to like dislike the daddy. She will, when the daddy is home and daddy want to give her a hug, she say, no, don't touch me, I don't like you. And she will ask the daddy to, "You go up, this is a girl's room," like she's like mean to daddy. So it hurts the daddy. Do you say, what have I done? So they thought it's the baby boy, but it's only to him, not to the mommy. So you say, like, what have I done? Like, I send her to school every day. I talk to her, I nothing changed, about me. So then I told her, I told the parents, so I say, look, it could be the child is confused. Then they say, why? So I say, your helper is a very good helper, am I right? So then when you at work, so your helper take care of everything, take care of them and play with her, take care of the baby boy. They say, yeah. I say, what is your relationship with your helper? I asked the father. So he said, no, I don't have a relationship with my helper. I said, no, I mean, I'm not saying that you have anything with your helper. I say, do you talk to your helper? She say, no, hardly. So if I need something, I tell my wife. My friend say, oh, like Mary helps her to iron the shirt, and Mary brings her the food, things like that, right? I say, okay, right. So this is pretty clear to me. They say, what do you mean? I say, from what I can see, it could be your daughter. She doesn't understand that it's a helper, because to her, helper is like her mom, because she's very, very sweet, very loving, and I love her. She loves me. She also she like mommy, right? But this daddy is very bad. He treats his mommy very nice. He treats his mommy very mean. He never talked to her, never smiled at her. Then the couple say, "Are you sure?" I say, "Look, tomorrow, okay, or you go home. I want you to have a little bit of interaction with your helper, all right? If like while she's there, not deliberately, I say you can say, "Hi, good morning, Mary. Thanks, Mary. Mary, could you please pass me the water?" Say something like that. Talk to Mary, okay? Then the father say, "Really?" I say, "Yeah." Then I can tell whether your child is confused. So he did just for a day. The next day, he just texts me. He say, "Oh my God." He say, I was just dropping the girl, so that on the way to school, she opened up. She said to me, she said, "Daddy, I actually quite angry at you, but now I like you already because you are nice to Mary." So this is very common in a lot of, like, in our Singapore culture. So that is where children first, like, you actually grow up in the environment that you constantly confused. You don't know who is this woman, right? And then the change, like, you change helper, you never tell me. I don't know, these people will disappear, right? And then I go to school and take care of my own life for myself at the age of 2 years old. You see, and then you don't have that the actual connection because you're constantly busy, right? Because during weekend, the only activities like playground, restaurant, or grandparent place, right? And twice a year holiday. This is literally a Singaporean children's childhood. So they learn about helplessness at a very young age compared to kids have moms at home, a closely knitted family, right? And they grow according to their age, where they're being sent out to the world in the phase that they are prepared. So these are the consequences that we see. We cannot, like again, like we say, what can we do? Nothing we can do. So this is where we see younger generation, younger kids, right, like coming to us and they mutilate themselves. They talk about their life not worth living. They want to die. Yeah. It's just like, it's not because of social media, because they learn it, and then the social media just emphasize it and concluded it. Right? It's like my feeling of this unworthiness is real. You see, so we can't blame the peers, we cannot blame the school system, we cannot blame the social media. I think we have to look at like the growing up of a child, right? What kind of environment, the bringing up that they got and you see the kids, they are very safe, very secure, very confident, right? And you can see the kids are really flip up the other side. It's like, what happened? But you look at the whole thing, it's like, yeah, they have a good family, parents still together, they have a good environment. But why is it like that? So it's just the dynamic, right? When the child have to constantly guess at, will I? Like, first you have to guess your parents' emotion. That is like, and I hear a lot of parents talking to their young kids say, "Do you know I'm very stressed?" It's like, how do you think they know you're very stressed? Right? I at the restaurant, at the cafe, you hear parents like try to, I don't know, try to get sympathy point or something like that from your young child and say, "I'm very hard to pay the bills. I very hard to buy you these toys." I was like, what the hell? I know you already have to buy toys, right? I don't even know what it's called work. But many times when we throw this at the kids, right, the kids get helpless because they don't understand, right? So and then they have to grow faster than they should, and that can cause trauma, they can cause anxiousness, they can cause heaviness, and then they have to learn to take care of, take care of themselves or of you, right? So this is where they learn to like behave. They want to be good for you, right? So many kids that I see, right? I ask them, why do you want to go to this school? Why do you want to score so well in your PSLE? So that my parents will be happy. Why do you choose this course? Because they will make my dad very proud. Nothing is for them. So if you grow up in a way that like for your 8 to 12 or 20 years of your life, like you just live for someone else, and someone else constantly think that you should be better, everyone will get depressed. Because you do, right? Eventually you will say that, how long can I do it? What else can I do? How much can I do? Because as they grow, they will have questioned themselves. But we think that they are, that is what they should and they can. No one actually go down to the level and see that. So this is where a lot of kids, they learn to mask. Like you say, how do we tell? We call that masking, right? We call that masking because showing, like when you show that you are anxious or you showing helpless, right? Is like you fail your parents, right? They learn that. So when you learn it from home, of course you bring it to the world because you believe that they are the same or they are worse. Because if your parents cannot even accept it, right, and they are your parents, what do you think the world can accept you? Right? If your mom cannot understand you, your dad is not forgiving enough to see that, right? Why do you think that the teacher can do that? Who is she? Why do you think the counselor can do that? Who is he? So we learn to mask. We learn to mask. So this is where you see lots of children, the parents got very shocked until they see the cut mark on the kid's body. They say, when was it? Like 2 years ago. Then they say, why don't you tell? They say, because I don't want to upset you. Right? And you see lots of kids, right? A lot of kids, when they go through their phase, right? There are only two types. They all have anger inside. Okay? Because anxiety, anxiousness is you have anger within yourself mostly because you just like, why can't I be so good? Why can't I just try? Why can't I like keep trying? So that you upset with ourselves. Depressed is you upset with others and yourself, right? So when someone take their life, if you look at all the cases of the suicidal case, right, you see what the people around them will say about them. Say, she is such a sweet child. He is so gentle. He is so kind. There are only two types. When they are so kind and so gentle and so sweet, yet they're so upset with the world, they hurt themselves because they couldn't do it. The other one, they hurt others, then they let themselves get hurt too. So then we will say that why the like the case of the shooting, right? Or the case of like the other boy killed the other boy, you see? And you can see that they have no exit plan. To them is I'm just so angry that I just want to do it, and then whatever. The other ones are I'm so angry that I couldn't do it, I do to myself. So self-mutilation, all these are like you can't tell because they learn to mask since very, very young. Because every day when your mom asks you, how is school? You must say good, right? Right? So if you say that, if you say that I don't like school because of the homework or whatever, then your mom will try to like give you like help you even like help you more where you don't want it, or they will get upset with you for you not like able to deal with the issue. You see, so you have to just say that good, because good make everybody happy. Good is peace. So masking is that. This is why getting harder and harder to actually spot them, because they become so pro at very young age, right? So that is where, parents have to be very mindful of that. Observation is very important. Yeah.
Yeah, so interesting, Jasmine, everything you've said. So many helpful tips and insights. Is there still a lot of stigma around mental health in Singapore, or is it getting
In the
better?
whole world, in the whole world. First thing you see, right, stigma, I think, to me, I think the biggest is like the lack of belief in recovery, right? This is where, just look at the adults' work, because the lack of belief in recovery, right? Employer not hiring people with mental illness. Why? Because you don't believe, right? So, like, oh, she got she got depressions, right? She got the episode, right? So, like, you don't want to rent your house to someone who has mental illness. You don't want to hire people with mental illness. You don't want to even like get too close to people who have with mental illness. Or maybe you try to like prevent your kids having friends who are suffering from mental illness. Why? Because first is lack of belief of the recovery. Second, we all straight away link it to untreated severe mental illness. It's scary because they either kill themselves or kill people. And the media is not doing a justice for mental illness, right? If you look at any news, right, you say that a man slashing, mental illness, a man stepping, mental illness. If you say untreated, if you look at all those cases, right, most of them are untreated severe mental illness, or they seek help, but they don't take their medication, right? So, but the paper are not helping, right? We just use the word mental illness, but mental illness, yes, everybody will have mentally ill at some point. Like, you have depressive mood, you have anger issue, you stress, you couldn't sleep. This is mental illness. Doesn't mean you will have to go out and hurt people. But the media is saying all this, right? It's not even helpful at all. So like we fight our whole life about stigma, but if we keep falling back to the same spot, like scary. So who want to be seen that way? Right? You wouldn't want to tell your boss, say that I think I am suffer from depression. I'm taking medication. You won't tell, because straight away you know that someone will get rid of you. You're scary. You will lose all your friends, your career, your life, whatever. So no one actually can think positively or constructively about mental illness. So stigma is always there, and we hasn't moved very far, because of all the story that we hear. And like I say, we need to learn to use the word untreated severe mental illness, not just a mentally ill man slash the wife, or a mentally ill man, stab the runner at night, like literally a big title on there. I was like, seriously? And you don't even elaborate of that. Just say that, like he just came out from mental hospital, and then he just took a knife and then he stabbed the runner at Bogo War or something like that. Like if you look at it, right, if you are mentally ill, if you're severely mentally ill, if you are under treatment, first of all, you will be asleep at 8 o'clock, because the drugs will make you sleep. You don't go at 12 o'clock and stab somebody. So that I don't even need to question. I already know that this man is untreated, severe mental ill patient, or a man. Right? So this is where we have to be very specific about mental illness, right? I can be mentally ill when I'm really overwhelmed and stressed, my mental well-being declining. So then I will just have to take a break, go on a holiday, try to sleep a little bit more, take a little bit up, like responsibility, mentally ill, right? So then I know that I couldn't control my anger. I hurt, like I hurt people that I love, unable to function. Then I can be severely mentally ill, right? So then I get, so then if I don't do it, then I become untreated mentally ill. So I hide. Then I try to end it, and this untreated, right? So most of the tragic story of mental illness, right there, 99% is untreated severe mental illness. So the stigma, yes, until we all learned what is mental health and what is physical health. Even though we thought, oh, we have talked about it, but nobody talk about this. Like everybody said, mental health is as important as physical health. And then what? We need to go further. So we are all of us are at this like a kindergarten level. So we have to keep going up and educate people. The school had to teach, right? Teachers had to know, right? Our doctors need to know, right? The parents need to know. Your boss needs to know, right? So lack of belief in recovery is real because no one's have any good story, right? Relapse is like, even though you say recover, we have the next word. What if she relapse, right? So that is like, how do we do that, right? So I think the first thing is like the specification of mental health and mental illness, right? And then the belief in recovery or in management. It's just like you ask them to say, oh, what superhero is about. So they say, oh, a lot of people just like, a kid says superhero can fly, right? But you ask them to draw a superhero, they can draw more things onto the superhero. They can add stuff because it's like they can see instead of just inside their head. So visual is taking things out of our head, right? And looking at it at the healthy distance, and to get a better perspective. That's why visual is so good. Like art is very good. Like looking at picture, when we actually think, right? We think in a lot of people think in picture form, right? You think in picture form. So this is why visual is very good, especially with very young children. Like I say, I use it when I know that the person is shut down, or very old patient that who's just not expressive, so they will actually, through the visual, they can tell you more things. Yeah.
Well, I mean, Jasmine, that was such a rich conversation, and so much knowledge you've imparted in this short space of time. So I really want to thank you very much for sharing all your expertise to all the parents and teachers out there.
Yeah, I hope it's helpful.
Very helpful. Thank you.
Yeah, welcome.